60 years old patient. He's a diabetic and hypertensive patient and presented with the NSTEMI, and you can see this angiogram of cranial view. This is a epicranial view, and you can see how calcified is the LAD. Patient was not affording for the any imaging procedure, and then we decided to do the cutting balloon calcium modification, and after that we put the stent in this patient. So this was the wire. We put BMW PTCA wire, and we tried to put the balloon and to try to pre-dilate it, but then it was not. So we took a Wolverine cutting balloon with 2.5 into 10, and we did the calcium modification in the mid LAD, and we tried to cut the calcium as patient was not willing for IVAS or OCT imaging. We could not see the calcium cuts or the cracks. So this was the around proximal Wolverine, and then we put the stent to this distal part. It was 2.5 into 30, and this was a stent deployment. And after deployment, you can see there's a, due to calcium, the approximation was not good, so we did the NC, and then we did the Wolverine cutting balloon in the proximal part. In Wolverine cutting balloon, we have to go 1 atmospheric pressure and wait for 5 seconds, and we have to go up to nominal. So in here we went up to 6 atmospheric pressure and 7, and RBP was like 9, and this was the second stent. Approximately we deployed, and you can see after that we see the picture like this, and there is a calcification, but with only with the cutting balloon we could do like this, and this is in caudal view, and you can see. So this was the final shot we have taken, and what maximally we could do we have done. So this is with Wolverine cutting balloon calcium modification we have done, as patient was not willing for any imaging procedure or any IVL or rotablation. We are done with this thing, Wolverine LC balloon, and then we did the NC after the Wolverine cutting balloon, and then we put the stent